nurses, nurses, and soon to be nurses. It is your girl Jaya here, and I'm coming to y'all with another video. As you read by the title, this video is going to be all about clinical as a first year RN student and what to do and what not to do as an LPN. Stay tuned to the video. Y'all won't be disappointed. So the first thing I can say expect at clinical as a first year, first semester RN student is to expect a lot of AM care. And AM care consists of meeting the basic needs of your patient. And that is getting them ready in the morning, helping them get dressed, brushing their teeth, cleaning up their room, cleaning up their bedside table and stuff like that. I know it's not the best part of nursing, but it is the foundation. You know, everyone on like their first night, like how I was in LPN school, my first night at clinical, I was like, oh my gosh, I'm about to be like running around with the doctors. I'm about to be in their OR. I'm about to be, oh my God, I'm about to be like this nurse. But it's like, no, you have to start small. You have to crawl before you can walk. And the foundation of nursing is being able to meet your patient's basic needs of life, and that is making sure they have eaten, that making sure their beds are made, making sure they are able to get up to use the bathroom. Just small stuff, but they have a big impact. So always think of that when you think of your first semester. So now I know that I have probably a lot of you guys worried, like, what am I going to do for 8 hours at clinical? How am I going to stay busy? So some ways that you can stay useful at clinical are: one, you can do vital signs. Take vital signs on your patients. Practice your manual blood pressures. Practice taking temperatures and respirations and cardiac assessments. Do stuff like that. Like, try to stay useful, because I know that a lot of the staff nurses start to get a little annoyed when they just see like, oh, the students are just standing around. Like, what are they doing? Because I know that when LPNs come and shadow me, I just be like, okay, well, this is the thing. What can you do? And then they be like, oh, I can do all this. And I'm thinking, oh, y'all didn't say y'all could do all this. So always be mindful that you can be useful in some ways. And that is taking the load off the CNA that may be on. So helping her take vital signs, helping her change patients, if that's already what you guys know how to do. And if that's okay with your clinical instructor. Always ask your clinical instructor if it's okay to help out the CNAs, because the CNAs, they are the foundation of nursing. Like, they help us out with everything, and they are our eyes and our ears as nurses. So getting in tune with helping them out will always make you a better nurse. Now, let's get in what to bring to clinical. So my first day at clinical, my pockets were full of everything that came in my clinical bag, everything that I ordered from Amazon. My pockets were full. You do not need that much stuff. So I'm going to tell you what you need to bring. A pen, actually 2 pens, because you'll probably lose your first pen. A pen, a highlighter, a black Sharpie, a red Sharpie, what else? Paper, a clipboard, blood pressure cuff, stethoscope, and a pair of surgical scissors. Okay, LPNs out there, this is for you guys. I currently live in the state of Delaware, but I go to school in Pennsylvania. So there's a lot of things that we can and cannot do as an LPN at clinical. As an LPN at clinical, you are not working under your license. You are working under your school's license. So therefore, whatever you learned in school up to that point, that is all you are allowed to do. You are not allowed to pull medications. You are not allowed to give medications if you have not already done that in clinical as an RN student. You are not allowed to go get labs. You are not allowed to draw labs. You are not allowed to do anything that you have not done at school at clinical. So I know, like, a lot of people, when they find out that I am already an LPN, they be like, hey, Jaya, can you do this? And I say, no, I'm sorry, I can't, because I'm working under my school and I'm not working under my license. So just be mindful when you're at clinical and you are asked to do certain tasks. You have to remember, hey, did I do this in clinical lab, or did I do this at school first? Because a lot of the staff nurses, they look at you as, oh, she can help. She's one of the students that can help. And that's not always the case, because we are not working under our license. You are working under your school, and whether your school is a RN program, a BSN program, whatever your school may be, you are working under them, and therefore you are a student. So you do not have a license according to them. So you are only allowed to do what they have taught you. Okay? Hey guys, so that brings me to the end of my video. I hope you guys loved all the content and the details that I gave you. Don't forget to like, comment, and subscribe below. I am reading all the comments, so if you have any questions, let me know, because I got y'all. I'm telling you, I got y'all. I'm not as fast, but I got y'all, okay? Nurses, soon to be nurses, wash your hands. And don't forget the thumbs.